Hello, this is Brandon Leonard, Director of Strategic Initiatives for Men's Health Network, and we're here for the Veterans and Sexual Health Dialogue meeting. And I'm joined by Dr. Tom Berger, who is Executive Director of the Veterans Health Council for Vietnam Veterans of America. Dr. Berger, thanks for joining us.
Thank you for asking me to participate.
So I wanted to start out by asking you to tell us a little bit about your work with VVA and the Veterans Health Council, and particularly on veterans and sexual health issues.
Well, it's a complicated, long story, but I'll try and be brief. The Veterans Health Council was formed about 6 years ago after we learned about the poor attempts at the Veterans Health Administration to reach out in terms of its program initiatives, its research efforts. And so we formed a partnership with academic affiliates such as various universities, professional organizations such as American Psychological Association, advocacy groups and health information groups such as the Men's Health Network, and others. And using all those resources, we focus on the health issues affecting the men and women who have served in the United States military. We focus not so much on the traumatic injuries that we've all heard about, like the amputations, those gunshot wounds, those kinds of things. To a lesser extent, PTSD and TBI, because they've gotten a lot of coverage in the media, but such things as parasitism and other kinds of injuries, including the psychological effects of all these things, resulting perhaps affecting men and women's sexual health.
And from your perspective, working with other veterans, where do you see sexual health fitting into overall health and well-being?
I think personally and professionally it's just as important as any other health issue that afflicts America's veterans. Because if you're having problems in the sexual health area, you're not going to have or be as successful in meeting your psychological needs and desires and that sort of thing. And it may also have an impact on your physical well-being.
What do you think needs to be done from, an advocacy community perspective, or, policy-wise? What do you think we can do to improve services and supports for veterans regarding sexual health in particular?
I think the first thing that needs to occur is we have to have an open, honest dialogue about sexual health, much in the fashion as we had today, but bring in those powers that be, so to speak. If we're talking about veterans, it needs to be people from the VA, needs to be people from DOD. Sit down and have a conversation with them, show them the information that clearly demonstrates the relationship of healthy sexual health to their physical and emotional well-being of the folks that they work with or they serve with, and then move forward with that. You have to raise the level, I think, of consciousness, so to speak, of the issue to a level where we can sit down and talk about it. It's not just special kind of thing. That it's part of everything else, like heart disease, like liver cancer, anything else.
Great. Is there anything else you'd like to share?
I would just like to say for those folks, particularly veterans or active duty personnel that see this video, if you are having sexual health problems, talk to someone about them. You're not alone. You are not alone. There are resources out there, although they're not as well advertised perhaps as for some other kinds of health conditions, but there are resources out there and you need to take care of it. You're not alone.
Dr. Berger, thanks so much for coming to talk with us today and for being part of the dialogue meeting.
Thank you.